evening, everyone. Dear Foxians and all we are watching this Foxy Gyan Pravah daily podcast series by all Foxy Committee Chairperson. I am Dr. Brisbala Tiwari, Chairperson Environmental Health Committee Foxy. Welcome you to today's episode number 275 Foxy Gyan Pravah podcast. Today we are having guest speaker with us, renowned cardiologist Dr. A.K. Pancholia sir. He is very well-known figure in cardiology, not only nationally but internationally. And we are having with us dynamic Vice President Foxy, Dr. N. Palaniappan sir from Chennai. And just briefing about this podcast. This is first time in history of Foxy meticulously designed series of daily podcasts on various subjects by experts to improve women's health. And they are not only on medicine, but beyond medicine, mythology, and so many things. And brain behind this beautiful concept is none other than our visionary president Foxy, Dr. Sunita Tandulwadkar madam. And madam is doing so many projects. And I invite Dr. Palaniappan sir, our vice president, who is excellent academician, very innovative leader, and so many innovative ideas sir is having in so many conferences. So I invite you, Dr. Palaniappan sir, to brief about the Foxy and bless for today's podcast.
Good evening, everyone who's watching. And good evening, Dr. Brijbala Tiwari and our guest speaker, Dr. A.K. Pancholia, who's one of the very renowned cardiologists of the country, who's known internationally as well. And as Brijbala said, the concept of podcast came into this year's Gyan Pravah series of Dr. Sunita Tandulwadkar, our president. And it's a concept which did not have before, but now it's come into picture because what opinion we had was whether you're in the clinic or whether you're operating or even otherwise, you could switch on the podcast and hear the experts. That's the first idea. Every day, 8 o'clock. And the second concept of the Gyan Pravah is that it doesn't mean that we need to speak only about fibroids and AUB and breech deliveries and cesarean sections. We need to speak something else apart, which will be of interest to the obstetricians and gynecologists of the country other than OBG. So the topic could be on spirituality, or it could be political, or it could be economics, or it could be anything. It could be related to OBG, but we generally don't talk anything related to OBG, but something else other than that, which is useful to the obstetricians of the country. So that is the very idea of this. And the concept was beautifully conceptualized by Dr. Sunita. And she said, the chairpersons, we have 13 numbers, so we thought we should engage them every day. And so we give them independent rights to say whomever you want to do the podcast with, you can. And all the chairpersons have been excellent. This is 275th, if I'm correct. And it's been going on fantastically well at 8 o'clock every day in the night. And the concept of podcast has been absolutely successful. And we're very, very happy to have Dr. Pancholia with us. And the topic for the day is going to be on environmental heart and, of course, the toxins, which Dr. Brijbala is going to speak because she's been doing excellent work on the environmental sciences because she's the environmental committee chairperson of Foxy. So who else could do this particular topic but the environmental committee chairperson and, of course, the heart expert. They will do a fantastic job, and I'm extremely delighted to have both of you here for the podcast today. And thanks, Brijbala, for involving me. And thank you, Dr. Pancholia, sir, for accepting to be our guest of honor today. And we were waiting, and I don't want to stand between you and the podcast. So over to you, Dr. Brijbala and Dr. Pancholia. And thank you very much. And I'm sure the Foxians are going to have a wonderful podcast today. Over to you, Dr. Brijbala.
Thank you so much, sir, for joining and spending your valuable time and blessing and gracing the podcast. And sir, Dr. Palaniappan sir, can you just brief about the Foxy different programs, Sampurna and all that? So our audience will listen that also.
Thank you very much for asking me that question. That concept of Sampurna came in when Dr. Sunita was installed as the President Foxy January 2025 at Mumbai AICOG. And the Sampurna is going all over the country now, and probably it will go international as well. Her concept was that the Sampurna was how is it going to be important to women who are going to become pregnant. So after pregnancy, there's nothing question of whether it treat the diseases in pregnancy or not, but we should be prepared for pregnancy. The preparedness for pregnancy is something which is absolutely important, is what Dr. Sunita conceptualized. So she says every woman in the country, whether she's pregnant or going to become pregnant, had to be prepared for pregnancy. And that is what, so we need to screen women for medical disorders in pregnancy, whether she's fit, anemia is not there, whether there is no diabetes, whether she's aged beyond 21, whether her BP is normal, sugars are normal, and things like that was the first started conceptualized. But then what happened was the Sampurna branched into so many things. We went from menarche to menopause, and we've been having series of programs. And to not to say culminate, maybe to do it in a better way, we are having a huge big conference in Pune on the 14th, 15th, and 16th of November called as the Star Sampurna Conference, where the entire program of the whole year maybe and the country and president's vision will come true on the 14th, 15th, and 16th with international speakers, almost 200 faculty participating in it. So it's going to be academics, fun and frolic on the conference, which is going to happen called as a Star Sampurna on the 14th, 15th, 16th of November in Pune, the city where our president is coming from. So we're all looking forward, and you will see the culmination of all the Sampurna projects, which is going to happen on these days. And we're going to have 3 halls there, and of course, a lot of academic events to happen. So if that would summarize what I'm going to tell Dr. Brijwala, allow me to say thank you and namaste to you, and over to you. Our guest speaker is waiting. Over to you, Dr. Brijwala, for the podcast.
Thank you so much, sir. Thank you so much for briefing all about the Fogsi Sampurna. So we are having very important topic, although not discussed a lot, because nowadays environmental pollution, environmental toxins affecting every aspect of health. And today's topic is hidden threat for all ages, environmental toxin and heart health. For that, we are having excellent academician, none other than Dr. A.K. Pancholia. Sir is MD, FACC, FCSI, and so many qualifications. Sir is head of the Department of Clinical and Preventive Cardiologist at Arihant Hospital. Presently, the convener of CSI Preventive Cardiology Council from 2013 to 2025. And Sir was organizing secretary at National CSI Heart Failure Conference. Sir was past president of Cardiological Society of India, Indore chapter, and Sir had received many awards. Recipient of Distinguished Service Award in Cardiology by none other than President of India, APJ Abdul Kalam in 2008. Recipient of Best Medical Teacher Award by National IMA. Recipient of BC Roy Oration Award by National IMA. Recipient of Special Award by Association of American Cardiologists of Indian origin in Chicago in way back 2012. Recipient of IMA National Award of Excellence in Cardiology in 2013. Recipient of Padma Bhushan of Dr. S.K. Mukherjee Chikitsa Seva Award 2016. Charak Award in 2018, and many more. And Sir is regularly writing chapters in Cardiology Update and Medicine Update and guest editorials in Indian Heart Journal. And Sir is having 65 publications with 40 chapters in the cardiology books. And recently I come across Sir's chapter written in environmental toxins. So who can be better than Sir on this topic? And so welcome you, Dr. Pancholia, sir, and thank you so much for accepting this invitation of Fogsi Gyan Pravah series. So we will begin with our talk now. Thank you, Palani, sir, for joining and gracing and blessing this podcast series. Thank you so much.
Thank you.
So
first of all,
yes,
greeting from the cleanest city of India, that is Indore. Today's AQI of Indore, it is 41 to 55, but that of Pune, it is 71 to 105. So Indore is still more cleaner than Pune. Okay.
So, sir, welcome. And today's session addresses a disturbing trend, the rising number of heart attacks and sudden cardiac deaths in young, apparently healthy people. Many of them athletes, doctors, professionals, and even those who do regular workouts and have no family history at all. They are apparently healthy individual. Their lifestyle is normal, but suddenly we come across the news. Many of our doctor colleagues in very young age, just they are doing PG and just they started their work, and suddenly they were working, they collapse in OT, they are operating. So these type of scenario we are really they are disheartening. And so this points towards something beyond genetics or lifestyle disease, and perhaps the invisible impact of environmental toxins, like air pollution, plastics, chemicals, stress related oxidative injuries. So we wish to listen from expert on this subject and renowned cardiologist. So welcome you, sir. So,
So
sir, yeah,
before I come to the answer of your questions, I would like to thank and also to congratulate Foxy President for starting this very important initiative to disseminate knowledge beyond the boundaries of obstetrics and gynecology. And thank you, Dr. Tiwari, for kind invitation to speak on a very important topic, although it is almost neglected topic, but very, very important now in this current scenario. Now, regarding your question, why people die or why there is sudden cardiac death in young, there are two different reasons in the different age groups. In the age group of less than 35, the young people they die because of not because of the coronary artery disease mainly. It is mainly because of some congenital heart disease which is hidden actually, and they are asymptomatic throughout. But when they come to the strenuous exercise, then it leads to development of malignant or life-threatening arrhythmias leading to sudden cardiac death. It is mostly the electrical death, particularly the most important congenital heart disease which is responsible is hypertrophic cardiomyopathy. But above the age of 35, it is most commonly because of coronary artery disease. It is mainly because of the rupture of the vulnerable plaque, because of the strenuous exercise, the release of stress hormones, and that is responsible for rupture of the vulnerable plaque, which is actually silent, non-obstructive, and therefore patient do not have any symptoms. But when they come across any strenuous exercise, that leads to sudden rupture, myocardial infarction because of complete obstruction of the coronary artery, and that initiates this malignant or the life-threatening arrhythmias in the form of ventricular tachycardia or ventricular fibrillation and leading to sudden cardiac death. So there are two different reasons in the different age groups. Now, regarding why, despite of no conventional risk factors, no genetic risk factor, why they would get coronary events? It is mainly because in one line I would like to answer that being Indian itself is a risk factor for the coronary artery disease. Being Indian itself. Why it is because this South Asian ethnicity is more prone to get coronary events because of the genetic factor, which is known as the lipoprotein small a, which is highly thrombogenic and highly thrombotic, responsible for coronary events, which is highly prevalent in the South Asian ethnicity where India also belongs. That's the explanation for that. And therefore, it is recommended to have LP small a once in the lifetime, and we have to manage that. Unfortunately, we don't have proper therapy for the this control of the LP small a, but the two, three drugs are in the pipeline, which may prove to be in the preliminary study they showed the promising results.
sir, other than this, like we are
Other
prone, we
than
are
this,
Asian.
yes. Recently, two more, apart from the conventional risk factors, two more risk factors are emerging. That is the air pollution and the poor sleep. They are the two emerging risk factors of coronary artery disease. Apart from the conventional risk factors like hypertension, diabetes, obesity, dyslipidemia, or smoking. So apart from those conventional risk factors, these two risk factors are emerging, which we are neglected to know. So that may be the reason for the coronary events in the young people, despite of no conventional risk factor, despite of no genetic risk factor.
Sir, so this is the toxins, environmental toxins, like you were saying about the air pollution, the air quality index of today's Indore is less, and if we compare it with Delhi NCR and northern
Oh, yes.
part, particularly after festive season.
I will tell you the alarming results from the WHO. 99% of the global population is exposed to the air pollution, which is beyond the normal limit of which is set by the WHO. This is very important. 99% of the global population. One. Second thing, around 3 million people every year died because of the air pollution globally. And thirdly, the scenario from Delhi, I will tell you, the Delhi scenario, a non-smoker living in the Delhi having the risk of coronary artery disease equal to the non-smoker, equal to the smoker who is smoking 40 cigarettes per day. So one non-smoker daily equivalent to 40 cigarette smoker of other state. That's the scenario.
So this is really a frightening scenario, and like you were saying, the WHO limit, particularly this particulate matter 2.5, that limit is, I think it is 15, but for Indian Pollution Control Board and other authorities have, for the India, it is around 60 or 70. So in spite of that difference in normal limit, we are crossing that limit. So these type of pollutions, they are everywhere and we can't prevent it because so many factors are there.
Yes.
Like you were saying, the obesity is risk factor for this cardiac illness, also dyslipidemia and all that. Even the obesity is because of these environmental toxins, plastics, and all that. So can you elaborate on this
The important
toxin?
toxins, important toxins, as you said, it is the particulate matter of 2.5. 2.5 means 2.5 is the measure that is in the micrometer. 2.5. They are so fine. They are responsible for penetrating the alveoli and the perialveolar capillaries, and they reaches the blood circulation and even to coronaries, and leading to inflammation followed by oxidative stress that leads to endothelial dysfunction, and that endothelial dysfunction is responsible for the plaque formation and leading to obstruction of the coronary artery. This is one way, and another way is the endothelial dysfunction leading to this LV dysfunction also, and leading to heart failure, which may be both heart failure with preserved ejection fraction and heart failure with reduced ejection fraction. Similarly, they are responsible for increasing the platelet aggregation and also reducing the fibrinolysis, responsible for hypercoagulable state. Apart from that, the inflammation leading to insulin resistance, dyslipidemia, and then the obesity also. And that is responsible for more prevalence of PCOS also in women.
So, sir, these particulate matter, 2.5 micrometers, they are invisible. They are going through respiration, alveoli, from blood circulation to each and every organ of the body.
Yes.
And that's why the young heart at risk. So not only the air pollution, but there are so many these chemical exposure also, particularly in occupations like Zomato workers or those who are in high traffic area, they are constantly exposed. So even they are not having any family history, they are limb thin, they are non-smoker, like you said.
Yes.
The people living in Delhi area, though even they are not smoker, but they are having that pollution of equivalent to 40 cigarette smoker per day.
40
So this is really a very
Yes.
alarming and invisible and neglected thing
And we should be
to
aware
which
of this link. Yes, yes. Everybody should be aware of this particular link, which is actually ignored by. In fact, this concept of the link between air pollution and heart is for last many years, but unfortunately, it is neglected by the medical fraternity, particularly cardiologists, because they are concentrating more on the conventional risk factors and neglecting this particular link.
So whenever
That is to be addressed everywhere.
so we need to make awareness among people, and we need to ask the people to use the mask and to avoid this. Particularly this time, the northern area, they are burning the crops, and that is also causing pollution. We are hearing every
Yes,
day
yes,
in
yes.
news
Agriculture,
papers,
yes,
the
burning the agriculture
headline
base,
solid fuel burning. Even those people in rural area,
fuel burning,
they
correct.
are not affording the gases like nowadays. Honorable Prime Minister had provided everywhere the gas,
Yes,
cooking
that
gas
is responsible for
facility.
indoor pollution. Yes, yes.
So indoor pollution is also very, very important,
Mm,
and that causing exposure from childhood, and that is causing, I think, that subclinical endothelial injury, and making them more susceptible to any cardiac insult whenever they are in stress, along with all these things. So previously we used to see the people having cardiac arrest after 50, but now we are seeing so many young death and sudden cardiac death,
mm.
other than congenital things which are not
There was
noticed, not diagnosed.
actually there was a wrong concept and the wrong information from the media also. This young child died of the cardiac heart attack or this heart. So it is not heart attack. It is the
Mhm.
cardiac arrest because of the this life-threatening arrhythmia. So it is more uh, electrical death rather than coronary event.
So all these are maybe because of these pesticides and heavy metals, organophosphorus compounds. Even in agriculture population, we are seeing they are not using proper protective gears, and there is not training up these people how much quantity they should spray
Mm.
and all that. Also causing sometimes people are coming
Yes,
with breathlessness and tachycardia, and they have done this spray insecticide, pesticide
very,
exposure.
very true,
So
very
there are,
true.
so like I think there are multiple type of this toxins. So sir, you had already explained that these pollutants triggers spasm, inflammation, and sudden clot formation, and without any pre-existing plaques. So, sir, can we prevent with some like hydration, proper hydration, and this air purifier in the house, and preventing that household this solid
Yes,
fuel
yes.
and
And self-protection method also, this use of mask when you are exposed to a pollution or when you are going to the heavy traffic area or polluted area. And they should be aware of when there is alert from the government on such as that the pollution area will be this. So outdoor activity to be stopped in those particular days.
okay. So
Should be
during
more indoor. Yes,
whenever there is excessive
yes. And of course,
pollution,
air
but
purifiers and filters are to be used. HEPA filters.
okay. So, like you are very much into cardiology since more than 4 5 decades, and you are doing a lot work and research on environment also and toxins also. So, these heavy metals. So, can you elaborate on heavy metals also?
The heavy metals are more responsible for water pollution. Like in water pollution, heavy metals are more involved, particularly lead, arsenic, and cadmium. So that is also to be checked up. And there are the various reasons for the water pollution also, agriculture and all leakage of the oil, particularly when in the ship from the ship and everything. So that is and from the sewage, from industrial sewage,
Yes.
household sewage. So that is to be taken care. And now once you detect lead, this heavy metals, now there is therapy also available, the chelation therapy. When it was neglected, but now it is advocated, particularly in the pollution related hazards. So chelating agent to take out all these heavy metals from the body. So that is now been approved.
So particularly those residing near the seashore or water bodies,
Hmm.
and getting exposure to contaminated water from industrial exposure and industrial proper the disposal of proper their waste product is not, they are directly disposed of into the water body,
Yes.
and that is consumed by the local poor people, not educated. And
Yes.
we have seen, sir, there was one study that some women's delivering babies and their babies are having congenital anomalies, and even at the age of 6 7 year the babies were having high level of mercury in the hair, and that is also so something more
And
about, sir.
these heavy metals also initiate in the same way. They initiate inflammation, followed by oxidative stress, followed by endothelial dysfunction, and followed by problems, so the cardiac problem or even arrhythmia also, because of the this hormonal imbalance, neurohormonal imbalance.
So exposure to these type of water pollutants, heavy metals, they are affecting our women when they are pregnant. So from the
Yes,
in utero exposure, and nowadays we are seeing a lot many women whenever we are delivering with PIH and IUGR, their placenta is very small, and they are having this spasm and atherosclerotic, sort of small solidified placenta. So similarly, sir, like you having
they are
this
also the
experience.
reports of affecting the reproductive health also, both in men and women. In men, it is responsible for reducing the amount of sperm also, its quality of sperm and the motility of sperm also, and in female infertility and adverse pregnancy outcome. What you said, because of air pollution or environmental pollution.
Yes, very correctly. That male infertility is rising like anything. Previously, we are not having so many male infertile male, or so bad semen quality, so less sperm number, so less motile sperm, so less morphologically normal sperm. But nowadays, we are seeing so bad sperm quality,
Yes,
poor morphology, poor motility. So that all because of this air pollution as well as more water pollution. And I was reading somewhere it is the noise pollution also affecting.
yes,
Uh,
yes. Noise pollution also, and there are reports available to those who are living near the airport. They are having more hypertension, more coronary event as compared to those who are living away from the airport.
yes, sir. So all
And
these
even
type
light
of
pollution also, light
yes,
pollution also, and there are study available. If you are sleeping with open window, then there are more hypertension and coronary events as compared to if you close the window and no light is there from outside. So there is
so
study also there.
so we have to be aware and we have to make people aware about all these things. They should have like plantation, good quality of water. They should prevent pollution themselves using the public transportation and all that. And this
So
noise
it is our
pollution.
duty to aware them about the link. It is duty of the medical fraternity, duty of the society, duty of the local administration, and duty of the public also.
Yes, sir. So it is the joint effort by everyone.
Joint effort.
Every like, but we are more. We can make people aware because this is we are not for treating the patient. We should keep them healthy. We should prevent something which can be preventable,
Correct.
like some things genetic and all that we cannot prevent, but these man-made illness, like these we are generating, our people are generating, which we can make our people aware. We can ask government to make strict policies and to
Yes.
implement that policies. Very very important, sir. So the light, the thing of simple putting of light and closing the windows can prevent happening this is simple tip which is not causing any special thing, any cost burden on anyone, but that simple
And
tip
it is
from
the
you.
duty of the medical fraternity to identify the vulnerable class. Vulnerable means those who are having diabetes, hypertension, dyslipidemia, heart failure, or to identify the pre-existing heart disease. coronary artery disease, pre-existing heart failure, pre-existing arrhythmia. So they are the vulnerable patients. So there we have to more concentrate on these people for the protection.
Sir, something about microplastic, microplastics, because we are living in the
Microplastic
era.
and
Mm. We are living in the era, everything is available with the
yes.
plastic, and
Mm.
that was once thought it is easily available, cheap, and but now it is a big threat. So, sir, elaborate on that also.
So microplastic and the nanoparticles are the emerging risk factors now, and government is also taken a step to stop using the single-use plastic also because of the same reason, and because there is a direct link between these particles or these risk factors along with the coronary artery disease or the cardiovascular disease. So these are they are again the same way. The pathomechanism is same: initiation of inflammation, oxidative stress, and followed by neurohormonal imbalance, also leading to arrhythmia, leading to coronary events, leading to heart failure also, or aggravation of the heart failure existing, which is what is called acute decompensated heart failure. In cardiology and beyond cardiology also, they are responsible for PCOS and other things.
Yes, sir. So, in even in heart tissue, sometimes people have seen the microparticles, and during surgical and intervention, they found that even in cardiac tissue, microplastics were found. Similarly, during in placental tissue, microplastics were found, and in testicular tissue, microplastics were found. So these are really big hazard to every cells of human, not only human but the other living organism consuming the contaminated water like fish and all that, and the people are consuming that fish, so indirectly they are also consuming the heavy metals and microplastics, so that is really alarming.
So we have to consider on this issue also beyond the conventional risk factors, because you always go on the conventional risk factors. You have to you know the link, when you are aware of this link, then you can concentrate on this. Even in the medical fraternity also, if a patient comes to with any event, the history of exposure to air pollution always to be taken.
Yes. So we need to ask about their occupation and the surrounding in which area they are staying, and they are exposed to any
Air
factories,
pollution or water
any.
pollution, whatever. Yes, that
Yes.
history is very important when you take a proper history in the during the medical examination.
So we need to go to back to basics.
Yes.
That is very, very important because of the recent modern gadgets and robots and everything.
Hmm.
We have to
Yes.
think beyond that. We have to go back to basic and
Yes.
talk to our patient
Because of
to.
that advancement, we are forgetting the basic.
So all these toxins, their exposure and their effect on heart at young age really frightening, sir. And we often emphasize for dyslipidemia about the diet and the exercise. And we are seeing the people having very simple diet, very regular lifestyle, and they are doing exercise. So, like you said, it is the air quality, water contamination, and the microplastic.
One thing more I would like to tell you. One thing more I would like to tell you, which is very very important.
Yes, sir.
As you asked the initial question, why young people are dying either in the gym or during sports or strenuous activity. Well, before joining any strenuous activity, have they undergone any cardiac checkup first? In our scenario in India, it is not. In United States, it is a protocol or it is a recommendation that should go for when they are going for the strenuous exercise. Even the school children joining a strenuous sport, the cardiac checkup is done, particularly echocardiography to rule out any congenital heart disease. And in adult means above 35 years, when they are going to join gym or any strenuous exercise, cardiac workup is to be done and fitness to be taken from the authority. And that test includes the CT angiography also. You have to go for that, and then you join your strenuous exercise. So whatever death which has been reported during sports or during gym, have they undergone any cardiac workup first? No. That is to be done.
So that is very, very important. Whenever one is going for any strenuous exercise or any joining any marathon, like we have seen during marathon run, people lost their life
Yes.
in between their this running, and then they come out in that they were having some cardiac issue. So it is very important advice by you, sir, that there should be regular cardiac checkup for each and everyone, even they are not having their any family history. So like you were saying about the women's exposed to, and you are seeing a lot many women's with early onset hypertension, and during pregnancy we are seeing preeclampsia, gestational hypertension, gestational diabetes, and because obesity is also increasing, latest marriage is also increasing, and PCOS all. So just can you elaborate on all these things, sir?
Yes, as I said earlier, because the air pollution or environmental pollution is responsible for adverse pregnancy outcome also. So whatever you told me about all this, it's all adverse pregnancy outcome, which may be related to exposure to pollution. And the reason is simple. Again, the oxidative stress and the inflammation.
So, sir, so many EDCs are like cosmetics also. Uh, salons, salons are using this dye and products, and these salons are not having proper ventilation, and that fume is accumulated in that
Mhm.
closed area. So, is it related with that also? Like,
Yes, it is.
is it?
It is also related. It is also related. Again, leading to oxidative stress, inflammation, and initiate endothelial dysfunction.
So all these endocrine disturbing toxins like BPA, phthalates, dioxins. So
The reports are there. There is alteration in the levels of FH and FSH also
yes, sir.
because of the exposure to pollution.
So they are affecting our HPO
Yes,
axis, and that is causing all these increasing
all this
PCOS,
process. Yes,
endometriosis, and um, like previously we used to say our women that we are protected because we are having estrogen and we are not having premature menopause, and males are exposed to cardiac illness, but
Mhm.
nowadays women are also because of the premature menopause
Yes,
also and metabolic syndrome,
yes.
like
Because of the neurohormonal imbalance.
okay. So all that are related with all these types of, and we are exposed to every day, like packaging material. We are drinking water in plastic. We are carrying because it is easy. In
Yes.
flight, we are getting that water and
Mm.
packaged food and all that. So we are paying the cost of
Mm.
this modernization. like during surgery, we are using a lot of disposable materials.
Yes.
Previously, we used to use this cotton, linens, mask cap, and reusable, autoclavable material, and we were not generating so much of medical waste also. So we also need to think, sir. What do you
So
say?
every level we have to be very careful.
Mhm. So this reinforces the
So
need.
once you are aware of that, then you will become more careful. If you are not aware, then you will forget everything.
So this need like reinforcement in paramedics, in clinician. I think then we can talk to
Yes.
laymen, then we can ask our government and NGOs to do something for awareness.
Paramedic
So
and clinicians are very important here. Paramedical because they arrive at the spot very early because they are the frontliners. So
yes, sir.
sometimes there is acute exposure leading to acute cardiac events in the form of either acute MI or acute life-threatening arrhythmia, or acute decompensated heart failure in the already pre-existing heart failure. So once you arrive there, they should know how to do CPR and how to use AED, automated external defibrillator. So they should know it. They are also we can use paramedicals for awareness program also,
Yes, sir.
and to send alert also if such and such area will be more exposed. So try to avoid outdoor activities in those areas. And they can also responsible for identifying the vulnerable classes also patient. And at the clinician point of view, as I told you, importance of taking history of pollution exposure at the time of arrival in the emergency room. And they are also responsible for identification of the vulnerable patient and to manage and correct those pre-existing conditions like diabetes to be controlled, blood pressure to be controlled, weight to be managed, and lipids to be controlled. So vulnerable patient can be treated accordingly. And of course, the public awareness program, use of self-protection and everything. So the clinician, we can utilize clinician for the public awareness program also. They can educate their own colleague also. And most important, to have seminars and webinars and podcast also, what you are telling, what you are arranging here, to disseminate the knowledge about the link between the pollution and the heart disease or any other disease. And one of the in the conferences, one should keep one of the session on pollution and heart also, or pollution or any other disease also. Recently, on the 4th and 5th of October, we had this National Conference of Preventive Cardiology, and I was the scientific chairman, and I kept one complete session on pollution and heart with three different speakers on the different scenarios. So that is also very important to keep sessions to disseminate knowledge to other doctors also.
Because, sir, it was not taken so seriously previously, and now with so many research in so many studies across the world, in so many countries, it is clear that there are these type of toxins affecting every cell of the human body from top to toe. And so just want to ask you, what other systemic changes should hospitals and clinics adopt?
With the protection measures,
Yes, sir.
use of air purifiers, use of filters also, these should be initiated in all the hospitals. And of course, the education programs, the burning of the medical waste or burning of the uh, waste in the open areas, so that is to be restricted. And at the government level or the local administration, they should have a heavy fine or proper guideline also for this vehicle emission and the industrial emission. They should have the heavy fine for this all this, and proper regulation should be there. That should be applied to the hospital also.
So, proper biomedical waste disposal of in proper way, and improving the sustainable healthcare practices, um, using less disposables and educating our staff and keeping some posters, I think, that pollution causes this.
Yes,
So
yes.
also those coming to hospital, they can at least read. And like you said, in conferences, there should be one session, because this is mostly neglected. It was not taken so seriously till, but now we are aware about the exposure to air, water, noise, and very rightly you said about the light pollution. So also to see the AQI indexes also. That is also, I think these are displayed now in every city
Yes, yes.
at some places, so we can read it and we can ask our government to do something for this. So, sir, any three key take home points for our audience?
most important is people should be aware of the relation or link between air pollution or environment pollution and the heart disease. One is the awareness about this particular link. Then it is the duty of the medical fraternity, local administration, society, and the public to have more awareness programs for the public regarding this link. So they should be aware. So once they are aware, then they will apply in their daily life. Most important. And of course, the role of clinician and the paramedical staff I already told you. So they should be aware and they should plan out the proper programs for the prevention of pollution.
So, like, you are
And
always behind the
yes,
preventive cardiology, sir. You are
preventive
always
cardiology. Yes.
always
And
promote
European had already come out the action plan 2050, action plan 2050, have a healthy planet for all. That is the slogan from the European Union.
So we have to be planet friendly,
Yes.
basically, sir. So, sir, so health is not only about the sugar control, not about the lipid control, or doing regular exercise. Also, should include the environment. We breathe, we eat, we drink water, and we live in it. I hope that is the mantra to keep every heart healthy and to keep
Yes.
our planet healthy. So,
And one thing more, our Prime Minister Narendra Modi has waged a war not against Pakistan only, waged a war against pollution and waged war recently against obesity.
yes.
Our own Prime Minister.
So, sir, uh, we like Foxy, cardiology, all medical fraternity, government, and people need to make our home, our city, our planet cleaner, safer, and heart friendly. So,
I
for
hope that in your next Foxy conference, you will have a session on this.
sure, sir. I will share your message, and Madam will definitely watching this podcast later because today Madam Dr. Sunita Tandulwadkar, Madam is in flight
Yes.
because Madam is traveling from Arogya. Sir, Fox is doing one more thing that is Arogya Yoga Yatra in different pilgrims like in Haridwar, Kashi, in Jagannath Puri in today madam is in
Very good.
Mathura, Rameshwaram, everywhere. Foxy team was going along with our president Foxy, Dr. Sunita Tandulwadkar madam, and they are doing their
But ask her to check ask her to check AQI of that area first.
yes.
And
So
use a mask.
yeah, definitely, sir. So great interaction, sir. And I think our audience, our viewers will definitely get so many take-home messages for the safety of their heart and to prevent the cardiac illnesses, and particularly those not related with genetics or not having any congenital issue will protect their heart from other illness. They prevent the cardiac disease due to environmental toxins with your advices, sir. And thank you so much, sir, for being with us. And
Thank you very much.
I'm so grateful,
Thanks
sir.
for keeping this topic.
Thank you,
Thanks for
sir. Sir,
keeping this
you are
topic which is
expert.
highly neglected, but
Thank you.
very important. Very important. Thank you very much.
Thank you, sir. Thank you. Good night, sir.
Thank you.
Thank you.